if all of a sudden, like out of nowhere. While working normal, your hand goes strengthless and you begin dropping things. You are unable to have firm grip. This kind of situation remains for a minute or more and then everything is normal. And you are puzzled and troubled. Then please continue to watch. First, let's consider some example S from people suffering from such situation, yes, who have shared their experience on the internet. First example.
At moment, even typing this is hard work and hurts like hell. In my case, keep dropping things or not holding onto things. And sometimes when I do manage to grip something, my fingers then won't let go and cups, spoons, etc. go for a slide across the work surface or crash to the floor. Right now, trying to type, my fingers do not respond to what I want them to do. It is almost like slow motion, but also fingers are numb, tingling and very stiff and painful. Can't even bottle feed my son, hold him, drive, write, type, shaky hands. Couldn't hold drinks in my hand, or they would get weak and I would want to drop it and dropped things occasionally.
Says Roxy. At such the person is puzzled, want an explanation as to what is happening with him or her, desperate to get out of this situation, visit different doctors. They then tell to do a lot of testing. The person does all the tests. Most often the tests do not reveal anything, and it takes a year or two or more. Ironically has been the experience of many. For the doctor to come to any conclusion, then different doctors have different diagnosis. All of this leaves the patient with empty pockets and a bitter experience. This is illustrated with the next example. Second example.
Eye pain, dizziness, brain fog, etc. And after a year of exams, MRIs of head, neck, spine, blood work, evoked potentials, ear, visual, etc., visual field test, optic nerve tomography, etc. I got diagnosed today after 1 year and 11 days. Migraines are not always headaches. I didn't know that. You can have occasional headaches, but also can suffer from persistent aura, visual disturbances, halos around lights, all sorts of visual things, visual snow included, pins and needles, dizziness, confusion, sense of depersonalization, burning feelings, tired arms and or legs, face pressure, numbness, occasional slurred speech, problems with concentration, anxiety and panic attacks, and the list goes on.
Now what is extremely important to note is that seizure can be mistaken for migraines. I repeat, seizures can be mistaken for migraines. So now let's understand what are seizures. Just as a sneeze is a symptom of a cold, seizures are symptoms of epilepsy. Epilepsy is a neurological disorder in which there are occasional electric overloads in the brain. The short circuits cause the seizures. It can even be said that a seizure is a sudden surge of electrical activity in the brain. A seizure usually affects how a person appears or acts for a short time. Many different things can occur during a seizure. Whatever the brain and body can do normally can also occur during a seizure. The electrical activity in brain is caused by complex chemical changes that occur in nerve cells. Brain cells either excite or inhibit, stop, other brain cells from sending messages. Usually there is a balance of cells that excite and those that can stop these messages. However, when a seizure occurs, there may be too much or too little activity, causing an imbalance between exciting and stopping activity. The chemical changes can lead to surges of electrical activity that cause seizures. But what causes epilepsy? Anything that affects neuron firing is the quickest answer, but in about half of the cases, the exact cause is unknown. Some possibilities include a lesion. A lesion is anything that shouldn't be there, a tumor or a cyst of some sort, trauma or injury, poisoning, and infection. Epilepsy can be a symptom of some disorders, such as cerebral palsy. Some disorders, such as celiac disease, wheat gluten intolerance, can lead to epilepsy. Some forms of epilepsy are genetic, but most are not. The nature of seizures varies, because the lobes of the brain control different behaviors, movements and experiences. Doctors generally classify seizures as either focal or generalized, based on how and where abnormal brain activity begins. Seizures may also be classified as unknown onset, if how the seizure began isn't known. Focal seizures. Focal seizures result from abnormal electrical activity in one area of your brain. Focal seizures can occur with or without loss of consciousness. Focal seizures with impaired awareness. These seizures involve a change or loss of consciousness or awareness. You may stare into space and not respond normally to your environment or perform repetitive movements, such as hand rubbing, chewing, swallowing or walking in circles.
Focal seizures without loss of consciousness. These seizures may alter emotions or change the way things look, smell, feel, taste, or sound, but you don't lose consciousness. These seizures may also result in the involuntary jerking of a body part, such as an arm or leg, and spontaneous sensory symptoms such as tingling, dizziness, and flashing lights. Symptoms of focal seizures may be confused with other neurological disorders, such as migraine, narcolepsy, or mental illness. Generalized seizures. Seizures that appear to involve all areas of the brain are called generalized seizures. Different types of generalized seizures include absence seizures. Absence seizures, previously known as petit mal seizures, often occur in children and are characterized by staring into space or by subtle body movements, such as eye blinking or lip smacking. These seizures may occur in clusters and cause a brief loss of awareness. Tonic seizures. Tonic seizures cause stiffening of your muscles. These seizures usually affect muscles in your back, arms, and legs and may cause you to fall to the ground. Atonic seizures. Atonic seizures, also known as drop seizures, cause a loss of muscle control, which may cause you to suddenly collapse or fall down. Clonic seizures. Clonic seizures are associated with repeated or rhythmic, jerking muscle movements. These seizures usually affect the neck, face, and arms. Myoclonic seizures. Myoclonic seizures usually appear as sudden brief jerks or twitches of your arms and legs. Tonic-clonic seizures. Tonic-clonic seizures, previously known as grand mal seizures, are the most dramatic type of epileptic seizure and can cause an abrupt loss of consciousness, body stiffening and shaking, and sometimes loss of bladder control or biting your tongue. So now, taking in consideration the above information, you can decide for yourself or any of your loved ones' situation as to if you have seizures and what type of seizures. So here we conclude the first part on this subject. In part 2, we will see some more important points that would help recognize and understand seizures and epilepsy so that treatment can start early, and in part 3, we will see the solutions, medicines, and cures. In part 2 of this video, with the title Hands or Legs Shaking, Dropping of Things, Staring, Seizures, Epilepsy, Treatment/Cures. The link will be provided in description and even posted in comments section.
Thank you for watching.
Thanks for watching.